everyone, I am Dr. Zain Khatib from Khatib Eye Clinic, Mumbai, and today I am going to be answering a very important question, and that is cataract surgery safe during the COVID-19 era? Okay, before we start, we are not in 2019 anymore, we are in 2021, and a lot has happened over the last few years with respect to COVID. We doctors have learned so much more. So, what we would do in 2020, early 2020, and what we do now is much more different. The extent to which we thought COVID was impacting healthcare earlier is much different from now. And as of today, if you ask me this question, is cataract surgery safe in the COVID-19 era? It is definitely safe. In fact, if you look at everything with respect to healthcare, you can never give an absolute answer. It is always relative. So I can't absolutely tell you that yes, doing cataract surgery is safe or it's not safe, but relatively it is definitely safe as compared to other surgeries, and here is the reason why. So when you talk about safety from COVID, we talk about from the doctor and paramedical staff's perspective and from the patient's perspective. First, let us talk about the doctor and paramedics perspective. For us to acquire COVID, if the patient who is being operated for cataract surgery does have COVID. So first of all, most of the doctors follow this norm that all patients undergoing surgery have to wear a mask, and most of the hospitals provide that mask. It could be a 3-ply surgical mask or it could be an N95 mask. With respect to cataract surgery, okay, the only part which is exposed during the surgery is the eye, and the rest of it is covered with towels and drapes. So there is no way from breathing if a patient wears a mask and there is a towel and there is a drape that the COVID can affect the doctors and paramedics. The only place from which it can affect is the eye, which is exposed. Now, does COVID travel from the eye to the doctor? In the earlier times, we thought that yes, it can happen, but now it is reported to be very, very rare. It is next to impossible or very, very unlikely for the doctor and paramedics to get infected with COVID, even if a patient does have it, because of all the measures that I told you about. But again, everything is relative. Now, what about the patient if the doctors or paramedics have it? Here, the risk is little more because we have a lot of people in the operating room, and even though the same principles apply, that the towel, drape, they all prevent the COVID-19 from spreading to the patient, but if a crowded OT is present and a lot of people have COVID, then the virus can theoretically enter the patient through the eye, which is exposed. Again, the risk of this is not much for cataract surgery. This is much more for other surgeries like abdominal surgeries or laparoscopies, where a lot of part of the body of the patient is exposed. Here, through the eye, theoretically the risk of COVID is very less. The answer is relative, but the risk of COVID for either patient or doctor or paramedics in cataract surgery is very minimal as of today. Thank you.